And today I will let you know something about ultrasonography, some basic thing about ultrasonography, and then we will discuss about some gynecological and obstetric point also. So now Dr. Asmond, please introduce yourself to the audience.
Okay, so thank you for giving me this time. I'm Dr. Asmond Mkanja from Zimbabwe. I'm a third-year student at National University of Science and Technology, doing ultrasonography. I think that's all.
Okay. Hello. The topic today I am going to deal is obstetric ultrasound, importance, and fetal biometry. Okay. Obstetric ultrasound is very important. First of all, I would like to say that ultrasound is only the modality which help to find obstetric condition, and without ultrasound we cannot able to detect congenital anomaly of the fetus. We cannot able to understand whether there is molar pregnancy or ectopic pregnancy or cystic hygroma, whatever. So ultrasound is considered one of the best modality for examination, especially fetal examination. Other than ultrasound, there are several imaging modality like CT scan, MRI, but they are not considered very good because uh, CT scan or X-ray produce ionizing radiation, which is very harmful for the fetus and mother also. Similarly, MRI is time-taking procedure, very expensive, and it may cause claustrophobia. So ultrasound is one of the best modality, not only to judge developmental variant, also we can do fetal biometry. Fetal biometry is very important for getting several type of information related to the fetus development and many more things. Even EDD, estimated date of delivery, we can predict by means of, we cannot means machine tell, Hana, after taking fetal biometry. So we will discuss many things, but in a short video I would like to tell little bit, but in next video I will try to explain more. Okay, now changing the slide, and in this slide is very important, Hana. This slide is dealing about the critical period of human development. Embryo development, so critical periods means which we are dealing with the time we will a period of human development. Everything you can find in this chart. First of all, I would like to tell or explain what is the exact meaning of gestation. Gestation. Many people don't know what is the meaning of gestation. Gestation is actually defined. Gestation is actually defined as the time between conception and birth. The time between conception and birth is said as gestation, and the entire period is said as gestation period. Now, gestation period can be subdivided into two period. Number one, embryonic period or embryonic phase, and another one is fetal period or fetal phase. So this one is the fetal period and this one is the embryonic period. Okay. Now, in critical period, what we are seeing that gestational period, entire gestational period can be subdivided into embryonic period and fetal period. Embryonic period is the period from 3rd week to 9th week, 3rd week to 9th week. Whereas fetal period is the 9th week till birth. 9th week till birth. So this is the critical human development. So first of all, we should have to know about the we should have to know about the periods, and then we can able to differentiate between embryonic as well as fetal period. Now, as the development progress, baby gain weight, baby gain weight, development occurs, and progress of various organ development also take place inside the baby body. Everything is given in this chart. Look, first month, second month, third month. In the third month, a baby should be 1 to 23 gram. So, during ultrasonography scan, we can able to assess the weight also, and if you will compare from this chart, you will get a very good idea that baby weight is normal or not along with its month. Suppose that a baby is of 8th month, it means it should be 1900 gram to 2600 gram. Okay. Now, entire gestation period can be also divided into three different trimester. First trimester is first week to 13th week, almost first week to 13th week. Second trimester is 14th to 25th week, and third trimester is 26th to 38th week. After this, you will get another very important parameter. If you are watching this video, you may take a screenshot also. These parameters are showing which part of the body organ develop on which time. Suppose that if we are talking about the central nervous system develop almost in the 6th week, and heart almost up to 5th week. Everything you will get over here. External genitalia in the ninth week of pregnancy, gender can be seen. So gender can be seen in the 9th week of pregnancy, and it is not allowed to tell about the gender whether she is male or female, but I will let you know how to identify it also. Okay. So External genitalia develops almost on the 12th or 13th week. Okay, now next page. So fetal biometry. There are several type of method by the help of which we can assess and measure, and every measurement depend on the time and phases, even period and trimester also. Suppose that when a lady get conceived and there is a sac in the womb, what we do? We will take mean sac diameter. When baby become more human, we take measurement of crown to rump length. So the time is already given over here. Mean sac diameter, crown rump length, 10th week. And in the second and third trimester measurement, we do biparietal diameter, 12th to 26th week, head circumference, femoral length, and everything. Okay. Mean sac diameter. Mean sac diameter. This diameter is useful in early pregnancy when fetal pole not identifiable. Can use early 5th week by transvaginal examination and 6th week by transabdominal examination. So, in 5th week, if you will do transabdominal examination, you will not get any image on a screen. But if you will do transvaginal scan, you will definitely get image of the gestational sac. Okay. First, you have to obtain the image either transverse or longitudinal image of the gestational sac, and then you have to measure. How you have to measure? On longitudinal scan, measure the length and height of the gestational sac. You have to measure the length and height of the gestational sac. Only measure the anechogenic area. You have to exclude echogenic rim. You have to exclude echogenic rim. Okay. On the transverse image, measure the gestational sac width only, but remember only an echogenic area. Okay. Remember only measure the anechogenic area excluding echogenic rim. Now what you have to do? You have to add the dimension length, height, width and then divide it by 3, you will get the mean sac diameter. Mean sac diameter in mm plus 30 is equal to gestational age in day. Example, mean sac diameter 9 mm plus 30 equal to 39 days, which means 5 weeks and 4 days. Okay. Now, next is crown rump length. Crown rump length is considered in the first trimester. Crown rump length is most accurate method to determine gestational age. Okay, but when baby become more human, crown rump length can be taken. Okay, the longest embryo length excluding limbs and lower sac. It is the length between top of the head and distal, top of the head to the distal sacral area. The optimum measurement time between 8th to 11th week. The optimum measurement time is 8 to 11 week. Okay. Rule and regulation. Look, rule and regulation for the measurement of crown rump length. Obtain a mid-sagittal image of the fetus. What you have to do? You have to take the mid-sagittal image. If you will not take mid-sagittal image, then you will do wrong measurement. Okay. For what you have to do? you have to obtain mid-sagittal image of the fetus. First, to be horizontal at 90° to angle of ionization, the fetus should be natural position, not hyperextended or flexed. ठीक है? Image should fill at least 30% of monitor screen. Place the intersection of caliper on the outer border of head, outer border of head, outer border of head to the rump. The maximum length from cranium to the caudal rump is measured and straight line. How you will identify that this image is median sagittal section, exact median sagittal, not sagittal section, median sagittal section. In median sagittal section, you will get a very good resolution. You can able to identify this area of nose also, and image will become more large and sharp image you will obtain. Okay? For crown rump length, what you have to do, you have to place the caliper on the upper vault. Okay, upper side. ठीक है? You can see the diagram. Intersection of caliper should be placed outer border or outer table of the vertex of the head rump. Placing the caliper in the inner border or on the border is incorrect and should be avoided. So what should we have to avoid? These all are wrong and this one is correct. Okay. Okay. This is the correct method of measurement. So this is example of correct method of measuring crown rump length. As you can see, this mid-sagittal section of fetus, the fetus is in horizontal and neural position. In this is example of correct method for measuring crown rump length. As you can see, this is mid-sagittal section of the fetus and fetus is in horizontal and neutral position. There is good magnification. Magnification should be very good. And if magnification is good, it means the image is highly magnified. It means you are taking image from the mid-sagittal section. And you can clearly see end of the fetus and caliper are correctly placed, so it is accurate estimation of the crown rump length. Okay, this is another example of estimating crown rump length. You can see image in the section is not mid sagittal, very blur type, not magnified. Okay, this is the second estimation of crown rump length. This section is also not mid-sagittal and baby is flexed. Yani कि fetus is flexed. So this is also wrong. Now, the stage of scanning and everything I will tell in the next discussion. Okay. Okay, thank you. धन्यवाद. Okay. ठीक है, okay.